So, Dr. Itai Danovitch, welcome. I'm very happy to talk to you. My name is Carol Perelman. And first of all, I want to thank Dr. Jorge Goldberg, Senior Consultant for Cedars-Sinai in Los Angeles, for Cedars-Sinai International, colaborador de Enlace Judío. And thank you very much, Jorge, for making possible this interview with Dr. Itai. Dr. Itai Danovitch is chair of the Department of Psychiatry and Behavioral Neurosciences at Cedars-Sinai in Los Angeles. You were appointed to serve as commissioner on the California Mental Health Services Oversight and Accountability Commission by Governor Jerry Brown in 2016. We're very happy to have you since the beginning of the outbreak. This is mainly a physical health issue. However, it's also a mental health issue, and we would like to ask you several questions so you can guide us through this epidemic with the mind.
Great. Well, it's a pleasure to join you.
Thank you very much. This is for Enlace Judío. Okay. So we humans are social animals by nature. How well can we do when isolated? Is there any past evidence, probably in history, so we can extrapolate this situation and learn from it, at least in theory, learn from it?
Well, I think that the premise of the question is exactly right. We are social creatures. We grow, develop, thrive in social contexts. And being deprived of social interactions is very difficult for us. In the extreme cases, we know that people who are deprived of complete social interactions can suffer tremendous distress, and depriving people of interaction creates profound anguish. Our current situation is a little bit of a hybrid. We're asked to change the repertoire within which we interact with each other. We still have multiple modes of interaction. We just are trying to avoid contacting each other, avoid interactions where we can inadvertently transmit this virus. And our challenge is to figure out how to be socially distant without being emotionally distant from each other. Our challenge is to figure out how we can find other avenues to connect with each other, to have a shared experience with each other, to be of service to each other, and to benefit from each other. And I think we see lots of inspiring examples of that happening, but we also know that it doesn't happen in the same way for everybody, and it's not an easy transition for people to make.
I love what you said. We can still be emotionally connected. I'm gonna take that. We find ourselves cut off from our normal routines and support networks, facing fear about our health and our safety. Stress is very high. We are experiencing a collective feeling, a collective anxiety. Can you explain to us the difference between anxiety, fear, and stress? What are we feeling?
That's a great question. So fear represents having an emotional response to a real threat. And we typically differentiate fear and anxiety as anxiety being having a fear response, a fear emotional response to an imagined threat. Oh. So when we have a fear response, but there's not an actual threat to us, or the threat to us is infinitesimally small. It's an intellectual idea, such as the risk that an airplane is going to crash, which is very, very small, but we can become very fearful and preoccupied about. Then we characterize that response as anxiety. But in the midst of a active threat, I think that it's fair to call what we're having to be fear, because we are fearful of that event.
Okay, so
I would say that the point where a fear response becomes anxiety is perhaps when the fear response becomes disproportionate to the threat, when it continues to escalate in spite of reassurances, when we can't feel safe, even though we are in a safe circumstance, even though we've been reasonably assured, that we're safe. When our minds continue to spiral and ruminate and circulate around the things that we're afraid about, and we're full of anticipatory worry, or anxiety about something that's not here yet. Perhaps that's where we move from something that's fear to anxiety. And then another differentiation I would make is when anxiety becomes a clinical problem, because anxiety in and of itself is very common to human experience, just like fear is. And the presence of having anxiety does not mean that somebody has a mental health problem. A mental health problem really occurs when the anxiety is causing somebody to become stuck, when it's causing somebody to become paralyzed, when it's so great that one can't think straight and one can't function well and take the precautions or engage in the activities or have the connections that we need in order to thrive, recover, be resilient.
How can we then stop the fear from escalating to anxiety and then becoming something clinical?
Well, I think when we have fear to a real threat, we have to stop and deal with the threat. So the first things first means getting accurate information about the threat. And by accurate information, we mean relying on sources that are credible sources. In our country, for instance, that's the CDC, or it's the WHO, internationally. And each of us has authoritative, credible sources that exist on the international, national, regional and local level. We want to rely on those sources of information. We want to follow the precautions that are recommended, because those precautions are how we safeguard ourselves. If we're in a situation where we're concerned about access to provisions, we want to make a plan. How are we going to get adequate provisions? How are we going to get adequate food and water and ensure that we have the supplies that we need? If we have elderly family or young kids, how are we going to ensure that everybody is cared for that needs to? So I think the first response to fear is managing the threat by integrating the information that we have and taking an appropriate response.
That's a dilemma, what you're pointing, because some people say, you know what, I am going to avoid the stressors, so I am going to avoid the news. But on the other hand, you have to be informed. So how much of the news can we digest?
Yeah, I think it's a great question. And it's hard to put a lid on anything, and everything these days. I think it's important to structure our day and to designate a quantity of time for those people that are finding that they're getting consumed by the news and by the deluge of information and the constant news cycle, to dedicate a specific quantity of time. Maybe it's a half hour, maybe it's an hour, maybe it's less, maybe it's more, but to consume information and make sure that one is updated. Maybe it's initially once a day, then maybe it's twice a day. I mean, one has to respond to what the actual circumstances are. I think currently it's reasonable to do this, once a day. And then to remind oneself to engage in other activities, to structure in other things that we do during the rest of our day, and to gently and compassionately remind ourselves to pull away from the news cycle when we find that we've already gotten updated from the day, and yet we're reaching for our phones or turning on the television or opening up our computer screens to follow more stories. I think at a certain point, the stories just stew, our fears and anxieties without actually giving us information that we can act on.
Then I want to ask you something, Dr. Itai. There was an article I read at the Harvard Business Review, and it was addressing this feeling as grief. Grief for the tragic losses of life, of health, of jobs, and grief for missing also little things like proms, graduations, vacations, coffees with friends, dates. Do you think this is called grief?
Yeah, I think it's a great question. I think that there are a lot of different ways to understand how people are reacting to this. And there's a great deal of variation in how people are interacting to this. I think grief is certainly one framework that's helpful that is one way of understanding this and giving us a framework for understanding how we react, right? The stages of grief that were characterized by Kubler and Ross, who delved into how people manage grief associated with death or dying, talked about these various stages that included denial, anger, bargaining, feeling depressed, and eventually accepting what it is that is happening to us. And then some people added after acceptance, meaning to that. I think that we all probably, every time we experience a loss, we go through various aspects of first hoping that the loss isn't going to affect us, then reckoning with the loss, and then making meaning of it or moving on with our lives. So I think it can be a useful metaphor. And certainly we know that some people tragically have had severe losses as a result of this. There's been tremendous loss of life. There's also been tremendous loss of livelihood. This has affected people in many different ways, not all equivalently. And so I think that there's lots of different frameworks that people might find useful for how to cope.
Well, with that in mind, I would love to ask you, in what stage are we collectively? I know every person as an individual processes grief in a different way, but as a community, I'm talking about the United States, probably also in Mexico, which had the arrival of the virus approximately 3 months after Wuhan in China. What stage do you think are we right now from the grieving process?
I think we're still in the early phases of this, because we're still beset with a lot of uncertainty about this. We have uncertainty, and it's part of what makes this particular threat so difficult to cope with. We're uncertain about how long it's going to last. We're uncertain about how severe or intense the surge is going to be. We're uncertain who is going to be affected and why. Why does it affect some people more than other people? How can it be avoided? We're uncertain who's most contagious and why. We're uncertain who has it and who doesn't. This is also something that has been pervasive in terms of affecting all domains of our life. And it's been something that is unparalleled, perhaps, in impacting just about everybody in all walks of life. It doesn't impact everybody equally, and we know that, like a lot of disasters do, it can exacerbate social disparities and differences. But we know that no matter whether you're affluent or you're destitute, this is impacting your life. And it's my hope that creates opportunity when we have a common experience like this, even if it's a common crisis, that it creates opportunity around things that can help us both individually and as societies. But I do think that's part of what makes this so difficult. So I don't know. I think we're still in a evaluative phase and perhaps a bargaining phase with mixtures of anger and frustration and dismissiveness, and other people being in phases of acceptance. I don't think we're all in the same phase.
And reaching out to your comment about how this virus gets into each individual differently because of different conditions, social conditions or physical conditions. And we know that pre-existing chronic conditions like diabetes, for example, can predispose or exacerbate the COVID infection in some patients. I would like to ask you, is there any psychiatric or psychological condition that can predispose a patient?
Well, homelessness, substance use disorders,
okay.
Right? The social disparities that are associated with mental health can. I don't think that there is any psychiatric diagnosis in and of itself that we know of that actually biologically predisposes you. but certain mental health conditions can be associated with other social factors, which may have in fact predisposed people to the illness. I think that one of the ways that we try to prevent, we want to do two things. We want to prevent ourselves catching this illness, and if we do catch the illness, we want to give ourselves the best chance of having a robust recovery from the illness, or perhaps not even experiencing significant symptoms of that at all. We don't know all the reasons that some people get sick and other people don't. We believe that chronic medical conditions can put people at higher risk, as can age. But what we can do about it is preserve and do everything we can to sustain and cultivate our health. So by trying to eat well, by take care of our nutrition, ensure that we're getting enough rest, that we're sleeping, at night and taking breaks, taking care of our mental health by finding ways to emotionally connect to other people, by engaging in activities that give us pleasure and that replenish our minds and our souls. For some people, that may be prayer, and it may be the realm of the spirit. For other people, it may be the realm, of the mind and hobbies that interest them. But engaging in those things to preserve our own individual health, I think, is a good way to also position ourselves to have good physical health if we're stressed.
There is a great word which I personally love, which is taken from the physics books, which is resilience. Mm-hmm. Resilience is the capability of a metal to come back to its initial state. And so resilience, we've been hearing a lot about resilience used also in the psychological and psychiatric being. So my question is, how can we build resilience in this situation? And you were starting to talk about different things we can do to achieve mental health in this crisis, and also probably to reinvent ourselves into this new normal.
I think it's a great question, and resilience is probably something that comes out of both traits that we have and qualities that we cultivate. One of the great historic thinkers, in the past 100 years that thought a lot about this issue, and that a lot of people are probably paying attention to right now, is Viktor Frankl. He was a psychiatrist who survived Auschwitz and several other camps in the Holocaust, and he shares many more lessons than we can convey in this interview, or that I'm prepared to give an adequate summary of. But I think one thing that he shared through his personal experience was that his own effort to understand and to make meaning out of what he was experiencing was a factor that helped him to survive experiences that one might think are unsurvivable. One might think would just completely crush the individual if it didn't eliminate the individual. And I think he took from his experience and from observing other people who were under, unprecedented and unimaginable stress and distress, a notion that the way we make meaning out of the troubles that we face, the difficulties, no matter how extreme, no matter whether they are physical, psychological, or social, can be in and of itself a path forward, a way that helps us to survive, and a way that helps us to thrive. So I think that we each have an opportunity to look at our current crisis for the opportunity that it gives us as individuals, and we each have an opportunity to be of service to the people around us. And when we give, when we are generous, we also receive, a lot in return. And I think that's one of several resilience mechanisms that we can directly affect.
I want to ask you, I've read that usually women have more stress-related disorders than men, particularly in crisis. In this crisis, women are more likely to bear additional schooling, additional work with this homeschooling and childcare responsibilities. And also we have all these nurses, which are mainly women. So are you, in your practice, having more women-related issues, topics, and consults, because I've read a lot about women having probably more stress in this crisis than men.
Yeah, it's a good question. I don't know. I can't say that I can yet detect clear patterns in my own practice to share with you anecdotes, and we don't yet have data and evidence to give an informed answer to that. It's also clear that the illness appears to be affecting men more so than women, and we don't know why. I think that there are, well-established gender differences in terms of how we express the emotions that we feel. I don't know yet, and I would wonder whether there are differences in how much we're feeling and responding to this, or differences in how we're expressing our responses.
Then this leads me to the next question, which is more a public health approach question, which we know that this crisis arrived when we had already increasing rates of drug abuse and suicide rates. And so do you think as the state should conduct large-scale popular screening for mental health? Not only the huge diagnostic for coronavirus test, also do a wide screening approach, like a public health approach for screening for mental health of the population.
Yeah, I think that the two things I would probably prioritize in mental health is, one, for people who have identified mental health and substance use problems, we don't have enough treatment resources for them. So for people who are identified already, I would focus on ensuring that we have adequate and high quality care that's available for everybody, just like we expect that people deserve adequate and high quality care for their health conditions. I think on the flip side, we also have an opportunity to bolster preventing mental health problems. And I think that needs to start at the level of our schools, with education and with how we teach people in schools. In order for prevention to work, it's got to start really, really early, because it's hard once people have started to manifest conditions, then they start to need more specialty services. So the issue of screening, I think, is essential, particularly once you have something to offer people who screen positive. In our current setting, when people are identified, we often don't have enough resources or enough quality resources to send them to, enough programs, enough personnel, enough clinicians. So, I would start with making sure that we have enough, treatment to offer people that are identified, and preventing people through early interventions and helping people develop develop an enhanced understanding of how to promote their own mental health. And then to the specific question that you asked about screening, I do think that screening is really important too. I think the place to do it is probably in the context of primary medical care, that our primary medical physician or a woman's health physician or the physicians that we see to get ongoing care, as part of their care for us, should be screening for our mental health, just like they review all of our symptoms, right? How are you breathing? How's your circulatory system? How is your gastrointestinal system? How is your skin? How is your mental health?
Yes, I think too, it would be very, very important and very relevant into probably catching some people before it's sometimes too advanced. No?
Yes.
I want to ask you about another thing, Dr. Itai, which is we're obviously worried about about the mental health of our healthcare workers. They are in the front lines. They are dealing with difficult dilemmas, with working extra hours, fear. How are Cedars-Sinai in particular, and then your thoughts in general about how to address this challenge?
Yeah, so it's we begin with the basics, so around safety, ensuring that people have the equipment that they need, which has been a big concern with this particular crisis, to be able to safely care for others, and to make preparations to deal with all of the scenarios that can possibly be anticipated, and to develop contingency plans for them. We're very fortunate at Cedars-Sinai that we've been able to that we have the resources, and we have a very generous community that has been incredibly generous in giving us resources, including masks and connections to seamstresses that can generate masks, and many different resources to make sure that our frontline providers have what they have. It's also essential to have really clear, consistent, and accurate messaging about what's going on. People need good information in order to trust the information and to know what to work with. And that's an area where we've been fortunate as well. We have a team of individuals with expertise in epidemiology and infectious diseases that have been able to integrate information from national sources, state sources, local departments, of public health and institutional sources, to be able to synthesize accurate interpretations and to show data. Third is communicating those messages through multiple different channels with our providers, and creating forums that can be used to have people feel connected and to have people be informed. And then fourth is a menu, is a wide range of options that can be made available to support the specific needs that people have. So for example, at Cedars-Sinai, we have human resources, counseling, and medical services that are available for individuals. We have an employee health services program that helps to address any COVID-19 related questions that people have. Today, we actually established a physician peer support hotline, through, in which we've taken a cohort of volunteers and trained them in how to respond, and created a call list for frontline physicians who may be feeling stress or distress, so that they can talk to somebody immediately about what they're going through. So there's a wide range of different options, and it's addressing the safety, the information, and then making a lot of different options available, because different things work for different people. There's some other factors too. I mean, the institution has created hotel space for frontline staff, so that they don't, if they are on COVID-19 positive wards, they have the option of not returning home if they're worried about infecting their loved ones, or their kids. There has been, increased access to things like showers, and a whole series of provisions to address the basic needs before getting to everything else.
Very, very important measures. And talking about kids, what do you suggest? How should we address this with kids and to avoid future PTSD with them?
Well, I think that much depends on the age, of the kids and the developmental readiness of the kids. I think it's one wants to hold two things in balance with kids. One is to speak with them directly and honestly, and two, to let them drive the conversations, to let their questions drive the conversations, because kids will often tailor the conversation to the level of readiness that they're capable of. So if we respond to their questions, then we take less risk that we're going to burden them or overwhelm them with our worries. And if we give them information, we see how they respond to it, we see if they have additional questions, and go from there. I think also kids, like we do, they model their own responses based on our response. So much depends on how we talk to kids, not just what we tell them. And if we calm ourselves and collect ourselves before we talk about things, those are the signals and cues that they're going to be taking. However, if we tell them everything's okay, but we are frantic ourselves, then that's the message they're going to take.
That's very valuable advice. And well, I would like to ask you if, we've seen a surge in the divorce rates in China after lockdown. And we know because of the news, they've said they found a rise in violent and abusive toxic relationships, women living in toxic relationships, which exacerbate being in lockdown. And we've seen it in China already. So what can you suggest to these women or to these men that they are in toxic relationships, how to deal with this situation in this time of lockdown?
Well, I'm not familiar with the specific study that you mentioned. It sounds terrible.
Yes.
Being at home can certainly be a pressure cooker, and can take pre-existing problems and exacerbate them.
Exactly.
I think that for people who are feeling the pressure, having an explicit conversation about boundaries and safe spaces and creating space for each other can be helpful, so that we can preserve and protect ourselves if we're feeling strained amongst our families, if we're feeling like we're losing, our temper, or somebody else is losing their temper. Often also it's helpful to talk about and to plan how to manage things when the iron is cold. You want to strike when the iron is cold, not when it's hot, because that's when we may be able to think about ways to deal with things. In terms of, how to deal with anybody who's currently the victim of abuse and mistreatment, the resources that are available vary so much from region to region, but there are resources everywhere. And I think what's important is that now, like always, one of the big barriers to getting help is stigma. It's shame, it's embarrassment. And I think it's important for people to reach out safely, but to reach out to find who they can trust and talk to, so they could have advice and guidance and know what resources exist, so that they can begin to use accurate information to create a safety plan for themselves. And a big part of that is getting over the hurdle of shame and being able to talk about this stuff. That enables you to learn that you're not alone. Sadly, so many people have to deal with abuse, domestic violence, and mistreatment, and to be putting together an actual plan for how to deal with it and how to achieve safety.
Well, I think we covered many aspects of mental health during COVID. I would like to thank you very much, Dr. Itai Danovitch. And if there is something else you would like to add, please feel free.
Well, it's been a pleasure to speak with you. I appreciate all of your excellent questions. And I anticipate there's a lot more that we're going to continue to learn as we have a chance to evaluate how we've responded. Because this is a stressor, a crisis that's affected all of us, it has created a common experience. And my hope is that we can leverage that common experience to do some things that have been difficult for us, to recognize the importance of public health, both physical health, and mental health, and also recognize that there are other threats that are out there, like climate change, that we can have an enormous impact if we just start to do something locally. And these are things that sometimes feel like they're out of our control and abstract, and so we can carry on our lives without paying attention to them. But once they arrive, they're very hard to deal with. So I hope that this cues us to look for other opportunities for us to start and act and do what we can now before the next crisis comes.
Well, thank you very much. Thank you to Dr. Jorge Goldberg, who made possible this marvelous interview. And I hope you help us through this crisis and end it whenever the frontline doctors finish their work, but you keeping us safe and clear-minded and healthy.
All right. Carol, very nice to meet you, and thank you again. It's a privilege.